Hello, everyone. Welcome to Heal, Align, and Thrive Show. I'm your host, Vithika. And today episode, I just want to talk about something special, not like just about the professional that I call the health works or actually coaching side. People come and give that advice, but the person who actually live in healthy life. So I just want to today episode we will go more on that our daily normal professional person how he manage their health. So before we start, we something most of us are living through quietly. Let me start with that. And funny thing is, we treat our phone like a VIP. Battery goes to 20% and we get panic. Where is the charger? But when our energy goes to 20%, we say it is fine, one more coffee that will help. And that is exactly the point. We are working hard, managing family, deadlines, responsibility, and we keep telling ourselves, I will focus on my health later. But the truth is, most health problems don't begin suddenly. They build slowly. Low energy become normal. Bad sleep become a routine. Stress become personality. Weight changes, sugar craving, high BP, and we just normalize it because life is busy. And then one day we realize something is very simple. I don't just want to be longer life. I want a stronger life. And I think that's our awakened part. So today's episode is not about fear, it is about clarity and small, simple habits that protect your health before problem begin. So today's guest, our, he, the things refreshing and much needed perspective to health. And he is one the focus of prevention, lifestyle, and real world habits. Not so go to the doctors and all that before we just before that we need prevent ourselves. And we are joined by Shardh Jain, a healthcare professional. He decade of experience across the pharma research, hospital, and health-related healthcare system in India and Middle East. Shardh has worked closely with high-risk professionals like peoples like pilots, armed forces, and oil and gas workers, helping design the manage their health system that focus on risk prevention and long-term fitness, not just emergency care. So welcome to with me, Shardh Jain, and he's today these days in Dubai, if I'm correct. And welcome Shardh to our
Thank
podcast.
you.
Heal and
Thank you,
Align.
BTG. Thanks a lot.
So Shardh, before we start, I just the podcast side. I have a you. I just read about you, and last time when we discussed, you mentioned you believe doctors should be paid to keep people healthy, not just to treat illness. What does a true preventing health mindset look like in a daily life as a busy professional?
Ideally, you go and you pay money every year to your accountant, to your tax advisor, who does everything for you so that the taxman doesn't come to your house. Same way, the doctor should regularly monitor you, should regularly advise you. You should follow the doctor's advice regularly, and you ensure that you don't need to go to a doctor in an emergency or when you are sick. He
Mm-hmm.
should be paid on a regular basis a fee to ensure that he keeps you healthy.
Mm-hmm.
It's like your savings every month, like you do systematic investment plan savings, you save every month, irrespective of what happens, so that at the end of the term, you have a big pool of money. Same way, at the during your lifespan, the doctor's job is to keep you healthy, ensure that you stay fit, fine, enjoy your life, not run to hospital. Oh, today I'm having a backache, today I have a headache, tomorrow I have diabetes, tomorrow I have blood pressure, sugar, cholesterol, all of that stuff.
Mm-hmm. Great point. Yes. So I think this is more on both side, the moral, responsibility. I will say doctor and patient both side, and
Yeah, I mean, you should be ready to pay a doctor and visit him regularly to take his advice and services rather than taking his advice and services only when you are feeling sick.
yes, I completely agree. We need to be
Most
very,
people go to a dentist only when they have a tooth pain. They don't
yeah,
go for a regular dental checkup.
yeah. And that's a very important part. When we are sick, that time sometimes things are already in bad position, and we can
Correct.
easily prevent early checkup and everything. We need to be careful. And sure, you have tested lifestyle habits on yourself for years, and which 2 to 3 habits give you the biggest health return with the easiest effort, like least effort, because everyone is busy in their life, kids, professional office, and this type work environment, corporate jobs also is like long hours. So what 2 to 3 habits give you the biggest health return?
So first habit is to control and eat, see what I eat, how I eat, and when I eat. So
Mm-hmm.
I keep a 12 to 14 hour gap between my last meal today and my first meal the next day.
Wow,
So
that's
that is first thing that I do. Two, three things are, I mean, I would say almost off my food habits. First is fried. Second is breads. I mean, the breads that we eat from the shop. And the third is sugar.
mm-hmm.
So I don't say I don't consume sugar at all, but I consume minimal sugar only when like in specific stuff. But as far as the bread is concerned, I don't consume bread at all for last few years, and I don't eat fried probably more than once a month or so.
Wow, that's very strict habits. I think the sugar is these days, especially seasons, how you manage in sugar with the when is a holidays, the
I
festivals
have a
and all that.
superb sweet tooth, but what I do is I substitute it with natural sugars like dry fruits, fruits.
Okay.
Instead of consuming white sugar, this is what I do.
Wow. And that's great actually. We can easily replace. I think we all have sugar, mostly in our Indian culture we always eat the sugar, right? But we can easily replace, I also try to replace my sugar habits, with the dates. I eat dates, or some, just use the yogurt instead of, whenever after eating, have a lunch or dinner, I looking something to sweet, and I just try to take 2 to 3 spoon yogurt, and that's kind of helped me. I think that's awesome. 2 3 things. And sure, the many peoples we are thinking about fitness for us means more on gym, six pack abs. How do you define fitness in a way that actually matters for real life?
For me, simple definition of fitness is exerting 30% more from a normal day and not feeling fatigued.
Mm-hmm.
Personally, I walk about 10, 12 kilometers every morning. I do about 200 skips, 20
Wow.
frogs, 20 push ups. But I mean, that's my lifestyle. It doesn't need to appeal to everybody, and not everybody needs to follow. What you need to follow is internally, you should feel healthy. You should not feel fatigued. You should not feel tired. After a day's work in the evening, if there's a sport to be played, you should not feel, boss, I am tired, I cannot play. So
Yeah.
that for me, if you are fit to do whatever you need to do and you like to do and you want to do, rather than feeling fatigued and tired about it, that means you are fit.
Yeah, I
For me,
completely
fitness is
agree.
not six pack abs or muscles or all of that. For me, fitness is you lead a normal, healthy lifestyle. You make sure your circumference of your waist is in intact. It's not really, you don't bulge around there. You can walk, you can run at times, you can play sports at times, physical sports, mental sports, you can track. So I do about 2 tracks every year. Um, which are about 20, 25 kilometers a day.
Wow.
So at least twice a year, I do about 25-kilometer tracks in a day.
That's awesome. That's, I think, awesome. Like, 20, 25 miles is long. So before we move further, I just want to, where you get this motivation? What, you were also like, I see your background, you were very busy with you know, your work, and where you get motivation, or like, there is some point we get turn around. Okay, now, you know, anything happen in our life, like, pain, or like, something has happened, then we realize, oh, I need to take care. So what is was a turning point in your life when you like, okay, I need to do with the, now I need to be look into my health.
So unfortunately or fortunately, you can look at it both ways. I lost my father to a sudden cardiac arrest when I was 15 years old.
Hmm.
And I mean, the entire family, as we all are today, we are all teetotalers, non-smokers, uh, hardly we eat any non-veg. So, that's the type of lifestyle. But uh, he stopped his sports for a couple of years, and he was more into spiritualism and things like that. And being a healthy guy, he worked the whole day, and at night he came home. He felt a little tired, fatigued, had some shoulder pain, sudden cardiac arrest, and he passed away. From that point in time, I had decided that come what may, I will ensure that I stay healthy. I cannot say I will live longer, but I can definitely say I will live healthier. My
Yeah.
focus is never to increase my length of my life. My focus is whatever I live healthy. So my grandmother was 100 years old almost when she passed away.
Wow.
And this is how she told me, after my father passed away, I spent a lot of time with my grandmother, my paternal grandmother, and she's the one who imbibed the skills of, staying healthy, eating healthy, living healthy, and ensuring that, you do enough to keep yourself fit.
Hmm. That's
I
awesome.
haven't changed my measurements to my tailor in last 30 years.
Wow. I think that's a beautiful point, Shardh. When sometime I have a family history with the father side, the heart attack, sugar, diabetes. My mother was passed away with breast cancer very early age. Like, she was, I think, in her 30 or late 30 or somewhere. So I also got a lot of things when, doctors saying like you need to go for test everything. I do that as a preventing, as you mentioned, we need to do a prevention things like, risk. But I also, like, see that I get very, you started very early, the health wise. But I just realized that time, like, when my daughter born, like, I need to be healthy for her at least, like, that was my turning point. But what I felt that time when doctor said that, and then I decided, okay, I'm not gonna be take from anything. I will try my best. I don't know, as you mentioned, no future, like, what gonna be happen, but I will make sure I stay healthy. So I think that's an awesome point. You know, that's, I think, it's a guidance and take experience to be, in put in your life and make your, your choices will be stay healthy. And as you mentioned, you walk for 10 to 12 kilometer per day, and still you manage your work life. And if I'm seeing our my own life, like, when I was in job, when I was, like, sporting, now even in the business, uh, how professional working professional build momentum to the in their routine, like, they need to be 10 to 12 because it's a time consuming also. What do you tell that, what do you suggest to them, like, how can they manage their daily life with the routine?
You will need to remove this time. I mean, I don't even take my mobile phone with me when I go for my exercises and walks. So this
Hmm.
is complete detox. I think about my day during this period, what I need to do today, what I need to do next over the next few days, weeks, maybe a year. That's all that I think about. And I plan most of my day during my walk.
Okay.
And you will need to remove this time. I mean, uh, even if you work 14 hours a day, you still have 10 hours. You sleep for 8 hours, you still have 2 hours. And this is your two
Mm.
hours.
Okay. Yeah.
You need to, I mean, medically, they say you need to do about 45 minutes to 90 minutes, five
Mm-hmm.
times, 6 times a week. I would
Mm-hmm.
say I do about 95 to 100 minutes, 6 days to 7 days a week. Except when I'm traveling, I'm generally not missing my morning routine.
Oh, I
Of
think.
course, I wake up early, I sleep early. Generally by 9:30, I'm off to bed in the night. I get up around 4:30, quarter to 5. I'm off from 5:15 to about 6:35, 6:35, 7 on a normal day. If I'm a little late, instead of doing 90, 95 minutes or 100 minutes, I'll do about 45, 50 minutes. But I'll not skip it.
I think that's a beautiful, a strong point. If you skip it, and then your mind, like, in an NLP, we also say that your mind start doing the pattern, building pattern. Okay, one day skip. Okay, do it tomorrow. Skip, right? So I think the staying discipline is the key. As even you get some days less time, but or more time some days, but need to be continued. I think that's some point.
It's like
And
eating food. We don't skip food, right? We eat food every day.
yeah.
We may eat less or more. Instead
Hmm.
of 3 meals, you may eat 2 meals in a particular day, but we eat.
Wheat.
If you eat, you need to burn.
Yeah, I think that's one line, but it is a sense of lifestyle. Like, if you eat, you need to burn. So that's and sure. These days, even a lot of people do the annual health checkup are common. We usually, if I'm seeing here in outside in India also people do that yearly checkup. Whoever is working is here also, but people still get sick, right? What are the most checkup? I'm not talking about for normal sick, but there is some big disease which is already in their body. Take long time to develop, right? What are the most checkup missing, or what are people misunderstanding about that? What do you think?
What happens is people take results little lightly, and it's like, most people have a New Year pledge that this is my New Year resolution. I'll do this, this, this. In a
Hmm.
few weeks into the New Year, most of those resolutions are not practiced. Same way, you go to a doctor, you get a checkup done. Doctor will tell you to do 10 things. You will probably do two, and the rest eight over a period of time will stop doing.
Get it
So
completely.
additional tests only if the current test reports that basic tests that you need to do are not coming, or you have a problem. You have a
Mm.
problem of swelling legs, or you have a problem of fatigue, or you have a problem of skin rashes. If you have some other issues, then you need to get further tests done. I don't want to recommend specific tests to anybody. That is probably best done by their general physician. But ideally, your basic tests, your basic reports, if there's nothing significantly wrong with you, follow what your doctor says. Otherwise, your doctor himself will tell you, herself will tell you that, these are the additional tests we need to do to rule out certain things, or to find out what is the problem, and, probably address it at the root cause.
Mm. I think that's a main point. Like, as you mentioned, after doctor visit 2 3 days, we miss all things. We don't take seriously, right? If they say, like, every day we said, okay, you need to avoid sugar. Okay, today I don't eat it. Tomorrow I will fix it, and tomorrow and day after that there is a party, there is a something. Just go and eat that one. I think that's a and as you mentioned, root causes we need to do it. These days we are like, I always say that allopathy, or like, if we don't work on our own habits or our health, the band-aid we are putting, like, we are everything these days we think like, okay, we will take tablet and everything is good, but we don't think about the underneath, like, we need to we work on our root cause. And root cause fix. It's need to be, we need to fix our habits, health, wherever we need to more attention. That's, I think, the point. And you worked for pharma companies, hospital, insurance system. How does this system influence the kind of care people actually receive? So.
So because of insurance and insurance coverage, I mean, many a times, even in India, including Middle East, the doctor will ask you, what is your insurance coverage? And you will show your card, your insurance package. And based on that, the doctor will tell you whether, you should get admitted to a hospital or not. Certain tests should be prescribed or not. Certain medicine should be prescribed or not. And at times, doctors do certain tests to rule out certain possibilities. But at times, they also do it because your insurance is covering and they get a fee out of it. I mean, it's not the right thing to do because many a times, because doctor prescribes tests, mentally you feel maybe there's something wrong. That's why the doctor is prescribing these additional tests to me.
Mm-hmm.
Most cases, it is not needed. I mean, I don't want to blame the doctors. They are doing their best to rule out anything. But at times, they are also driven by greed, and which is not the right thing to do. Even the insurance companies will, want to make sure that, you get adequate care. But on the other side, they are also, looking at the doctor and his management. And at times, the insurance companies will reject something which they should not reject.
Mm-hmm. That's true.
And which is not fair as well. Ideally, it should be more like a model where if the doctor is prescribing, instead of insurance rejecting, the insurance should check with the doctor why is it required. Get that from the doctor rather than rejecting it outright and making the patient feel on the other end, on the lower end of the spectrum. Most patients will actually, if they can afford, they will pay from their pocket and get it done. Nothing wrong with that, but the doctor should be asked, why did you prescribe?
Yes.
Rather than rejecting it from the patient, the doctor should be questioned. The insurance premiums are paid either by companies or by the individuals.
Yes.
The prescription is not done by them, that is done by the doctors. If the insurance company is rejecting it, it should not ask the patient or tell the patient, should tell the doctor.
I think that's a great point, especially as you mentioned, India still we have option, we can go to privately. But in the US, if I something is prescribed and my insurance said you cannot do it, we cannot afford it even you're a millionaire, right? Because the expense, medical expense, and also it's very hard to get any test done without a doctor prescription, right? And if your insurance actually declined without telling, just to be as a patient, there was a I remember that there was a case happened in Washington close to, I think, few years ago, whereas the doctor prescribed for something about for cancer for year and a half, but insurance declined, and then the person got his cancer was almost in third stage when they again did the test, and the doctor said, patient, I told you to do it, and he said, my insurance declined that test. And this is very uh, big issue, especially in foreign countries, when the insurance sometimes they just decline, the test. I had, in myself, I had I broke my arm, and then with my insurance, my husband insurance, we had surgery, but I was not able to get proper any physiotherapy. They are saying, it is not included. So it's very hard to go afford to be, we cannot afford outside to go and do it. So I think this is the big gap. Insurance systems need to be improved. Almost, I think, every country this has a issue. And Shardh, if coming back to in your personal experience, uh, you are in your 50 and you focus on health span, as you mentioned earlier, not just a lifespan. what does slowing aging look like without extreme biohacking or expensive protocol? Like, lot of things is going on, like, whereas we said that, okay, if you need to be, you can stop aging, you can do this, few other things, like, for body things and mental and all that. So what do you think, like, slowing aging look like without extreme, there is biohacking and expensive protocol?
So slowing aging is similar to staying fitter, but
Mhm.
increasing lifespan means you are challenging the biological clock of your body. Um I mean, I'm not religious. Probably I'm more like an atheist. But one of the few things that as a child, when we were growing up, we were explained
Mhm.
that the day you are born, your last day on earth is also, decided.
Decided.
The only thing is how healthier and fitter journey you have, but your end date is more or less decided. This is what we were told, we were explained when we were kids. Even now, a lot of spiritual gurus say that. So I don't know if I can increase longevity of my life, but I can increase or I can improve my health quotient. One of the few things that we read a lot globally, including Western world research, is to eat dark chocolate. So, I mean, in India, we have a company called Amul. Amul is a like a household thing in India, and they have a 99% cocoa chocolate. And
Mhm.
I eat like one cube of that every day. I don't know if it is going to help or not, but just out of curiosity to see. So, one of my very close friends is a doctor. Um, he's MD, something, something, something. And he told me, Sharad, he has a center where he promises that it will increase your lifespan, longevity. And in that center, one of the few things that the patient or the person who's there, I don't want to call them patient because some of them are not sick. They're just going there to, increase their lifespan or life quality or health or whatever. And he gives them that chocolate every day. He himself consumes it. I mean, whenever we are together for a day or two, I see him like popping 3, 4 cubes of it. The taste is, very, very difficult, especially for somebody who has
Yeah.
taste for flavors. But so now I've got a habit. So I have one cube of it every day. I don't know it will improve my health or increase my lifespan or not, but nothing wrong in trying it. It's natural cocoa, so it's a very natural product. There's no sugar in it, so
I think the
not to say
cocoa
I
is,
don't have sugar chocolate. Sorry.
cocoa is also, the dark chocolate is also recommended in Western side also a lot.
I know
People,
it's from
yeah,
Western world. It's not recommended in India. In India, it was never there. Cocoa
yeah.
is not something which was prevalent in India before. So in India, our grandmothers and all of them never spoke about chocolate. They would say, "Why eat chocolate? Eat sweet. We make from desi ghee and good." So that's a very different concept they have. For them, eating sugar is not unhealthy.
Yeah, that
The
is,
place I come from, every meal starts and ends with sweet,
that's true.
and people are fit there.
Yeah, that's, I say, like, I will say that, like, sure, this I will coming back, as my, as a life coach, I'm like, lot of things in our body and mind is a stress created, like, there is a lot big myth when you get diabetes because you are eating more sugar. This is a big myth. I always see that, like, the getting the sugar is more on stress. That is already Stanford and research show already that, like, sugar is like, when you are getting sugar, you don't have a diabetes before, that is more your stress, anxiety, how you manage your hormones, how you manage your stress. But we actually, everything we put on that sugar, right? If I eat more sugar, I have in my family some people, they are more on 50 or 60, more than 60 or between 70, and he eat a lot sugar, like lot of sugar. When you say that, like, teas are full of sugar, right? But still he don't get diabetes, he's happy, he's, playing, he's do the footballs and everything, he's healthy, but he didn't get any diabetes. And my dad and my mother-in-law, even she didn't eat, even in young age, sugar, nothing, but they get very early age diabetes. So I think that's a So many myth we have that, and stress and anxiety we just ignore that one.
It is also to do with your bile.
Hmm.
How does your bile process the food that you consume?
Yes, agree.
So some people have stronger ones which flush the insulin out. Others don't.
Yeah, that's true. That's also, and sure, you're clear that you're not a doctor, right? But don't give
Yes.
medical advice. How should people evaluate their health information without failing for trends or fear-based content? Because um, sometime I will say that it's a very good to have a prevention, but sometime when we went to doctor, like I will give my example, like when I start to, they do my genetic test because my mother has a cancer, my aunt has cancers, they do that. And once I had something in, during MRI, they do every 6 month or 7 month. I got little things, it was just tissue, but they make me so much stress on that. And like for 1 2 hours, like literally they are hugging me, doctors, and it's okay. And after 2 hours I just like, okay, I'm not getting anything, it's just tissue, we will find out what is that one. But how you should, people get, sometimes doctor also push you, sometimes you get social media things, lot of things is like, information more, sometimes more information get you on that way, whereas you are not able to handle that. How you feel like, without, people evaluate their health information without, like, the content based, fear based content.
So more than 50% is in your mind. And how do you take it?
Mm-hmm.
And there's ample research available which says that every human being who is living has cells that can become cancerous, which can become malignant,
Mm-hmm.
right? So that is one part. I mean, not just about, there are a lot of other diseases apart from cancer. There is diabetes, there is blood pressure, there is cholesterol. For anything that comes, you need to find a way to, change your lifestyle, change your course of living, change
Mm-hmm.
your habits to improve your health. I mean, in today's day, age, and time, most of the diseases have a cure.
Mm-hmm.
And I mean, I don't know if you've seen a movie called Anand. It's a Rajesh Khanna movie.
Yes, I saw that. I love old
Okay.
movies.
Okay. So that movie gives you a very classic example of how a person should behave, knowing that he's chronically ill with probably 6 months to go.
Yeah.
Live life to its fullest, guys. I mean, as I said, the day you are born, your last day on earth is decided. The day you are born. I
Yeah.
mean, even before you are born, the day you're conceived in your mom's womb, your last day on earth is decided. In certain cases, it's within the womb itself,
Yes.
right?
True.
So live fit, live happy, live healthy.
Hmm.
That is all I can say. You cannot change destiny.
That is true.
Just ensure you stay healthy.
Yeah. And thank you so much, sure. That like, before we wrapping up, but last question: if someone listening want to feel fitter, like, calmer and more energetic in next 90 days, what simple framework would you suggest to they start with that? Because you already living that life and practical life. I think we sometimes we just give that advice, but when who live it practically, that will give the best suggestion.
I mean, I can tell you what I do. I mean, it all depends from person to person. Not every person will, you know, uh, be able to do the same thing and get the same results. For me, I just do about 15 minutes of meditation in the morning before I go for my walk, run exercises. And what I do, I always said, I run, I walk more, I run less. Then, I mean, a lot of things I do in between, like, but these are small, small things which you can decide what helps you. I walk backwards at times. So those are type of things. I do stretching exercises. I do arms exercises. I don't do any weights.
Mm-hmm.
And I don't sprint a lot. I jog a little, but I don't sprint a lot anymore. I used to, I don't do it anymore. Not needed. All I need to do is make sure that my blood pressure goes up beyond 140 and comes back to 120 in less than 3 minutes. That is
Oh.
my focus. My focus is more on my blood pressure, my lifestyle, how I feel in my body.
Mm-hmm.
It's nothing to do about uh, that this is what if I do it will work. No, it keeps on varying every now and then. I keep on looking at people, keep on reading, researching, and if I like something, I try and absorb it in my system, in my routine. If it makes sense for me to continue, I continue. If it does not make sense, I discontinue.
Yeah.
I'm not a great fan of yoga, although I do practice some asanas on need basis, but that's like once a week or twice a week on weekends, like today and tomorrow. But otherwise, no.
No, that's I think simple way to be explained. Like your day. It is, and it is very important to listen to your body.
Absolutely.
If you don't
Most
listen to your
important.
body, yeah, if
Most
you
important. Listen to your body.
yeah, you need to be listen to your body. Like sometime, if you notice these days, like lot of young people's got heart attack in gym. We heard about that because we sometimes the other person is pushing you, but your body is not allowing, and you are just doing because the other person pushing you, right? It is, you need to listen your body, what your body needs, because you are the one person who can tell that, and that's my doctor also always say that, like do the 20-45 minute wait and all that, and I always say that, like I just listen my body, and I don't gain weight, I'm just fulfilling whatever your requirement. But I don't do 45 minute, I just do, like someday I do like 1 hour, someday I just do 20 minutes, because that day my body is not allowing me. So listening your body
Absolutely.
is very important, and I think that's a beautiful point. And sure, before we wrap up, anything you need to tell my audience, like for any last things you can tell about
The only
suggestion.
thing I can say is stay happy, guys. Life is short to be sad.
Very important part. Thank you so much. And Chad, thank you so much for your grounded and eye-opening conversation. This is very practical, very, very nice, like discussion. And what I really loved today is the you brought health back to something simple and real, and prevention, consistency, and practical habits. And to everyone listening, if this episode give you some clarity, don't try to change everything overnight. Just listen, as Shardh mentioned, just listen your body, choose one habit, make it consistent, and then build that. And because prevention is not a dramatic, it's a disciplined, and health is not built in emergencies, it's built quietly daily. So just listen your body, make a discipline, even for 1 minute, even for 5 minutes. I always in my coaching also I suggest that, like if you don't have a 20 minute, don't do, but do at least 5 minutes. Make your brain, train your brain. Okay, this is my discipline. That's what I need to follow. And everyone, if you enjoyed this episode, please subscribe to Heal, Align, and Thrive Show, and share this with their friends or family members who needs it. And comment your biggest takeaway. And I love to reading that. And sure, if you are not professional, but sometimes people need a little bit more motivation, where people can connect with you or learn more about your work, how you manage your health and everything. So do you have any
Best way
Instagram?
to email me or WhatsApp me.
Sure, sure. And we will share his email with our in episode. And till that, and you listening, as we always say, heal with love, line with love, and thrive with the life, beautiful life. See you in the next episode. I'm your host, Preeti Kang, Heal, Align, and Thrive Show. Thank you, everyone.
Thank you.